Hi, good day everyone. This video is about blood culture procedure following Kim's policy and protocols. Blood culture is a test of blood sample to find microorganisms that can cause an infection. The presence of these microbes indicates bloodstream infection such as bacteremia or fungemia. Blood should be drawn prior to initiation of antimicrobial therapy. Before starting the procedure, we have to check the doctor's order for blood culture. Appropriately collected blood culture, sample free of contaminants, can help to ensure accurate results that will improve patient outcomes. Gather all necessary materials. A trolley contains 1 set of blood culture bottle. Green bottle indicates aerobic culture and orange is anaerobic. For adults, collect 8 to 10 milliliter. Yellow bottle is for pediatrics or infants which needs 1 to 5 milliliter blood. Inspect the expiry date of the culture bottle. Also, for any evidence of contamination, visible damage or any leakage. Label the blood culture bottle with appropriate information such as patient name, MR number and date. Other articles includes hand rub, sterile gloves, sterile gauze, tourniquet, kidney tray, blood culture holder, safety lock blood collection set, alcohol swab, spot band-aid, Macintosh, microshield tincture, sterile dressing set and a sharp box. For bacteremia, fungemia and other organ-specific infections like meningitis etc., blood culture is taken from 2 different anatomical sites, one after other without time interval. For suspected infective endocarditis or other endovascular infections, draw blood at spaced interval 30 to 60 minutes. Wash hands using soap and water and dry them. Move to the patient bedside with the arranged articles. Enter the patient room after knocking. Introduce yourself. Use hand rub. Before starting the collection procedure, check the patient identity with name and MR number. Explain procedure to the patient. I need to insert a small needle into your vein to collect blood sample for culture. It will be a little uncomfortable, but it hopefully won't be painful. Are you okay for me to go ahead with the procedure? After getting verbal consent from the patient, get all the arranged articles near to the patient's side. Use the hand rub. Position the patient's arm over a Macintosh. Inspect the arm for suitable vein. It should ideally be visible without applying the tourniquet. Apply the tourniquet approximately 10 to 15 cm above the planned puncture site. Palpate and locate the vein. Use the hand rub. Don sterile gloves. Disinfect the area in circular motion from inner to outer circle for 30 seconds and area of 5 centimeters with tincture and wait for disinfection. Do not touch the venipuncture site after preparation prior to phlebotomy. In case if you touch, repeat the site. Open the blood collection set, attach the needle set to the collection adapter. Insert the needle into the vein with the bevel of the needle face up at an angle of 10 to 30 degrees. Remove over caps from bottles and cleanse each rubber septum with separate 70% alcohol swabs. Allow septum to dry for 1 minute before inoculating the blood. Do not use povidone iodine for this purpose. Attach the aerobic bottle first. If the anaerobic bottle is collected first, the air contaminated in the tubing would alter the atmosphere of the anaerobic bottle. For pediatric patients, a special pediatric aerobic bottle may be used and inoculated with up to 4 ml of blood. Place the adapter cap over the aerobic bottle and press straight down to pierce the septum. Continues to hold the adapter cap down during the collection. Keep the bottle in upright position below the patient's arm during collection. Use the fill mark to accurately gauge the sample volume. Once the aerobic bottle has been inoculated, remove the bottle from the adapter cap, insert the anaerobic bottle and repeat the collection procedure. Use the fill to mark to accurately gauge the sample volume. If other blood tests required, always collect blood culture first. After the desired amount of blood is obtained, release the tourniquet and place sterile gauze over the insertion site while holding the needle in place. Withdraw the needle and hold gauze firmly in place until the site has stopped bleeding. Apply spot bandage. Repeat the same procedure in another site. After inoculation, invert the bottle 8 to 10 times and recheck patient identification of the culture bottle along with correctly filled culture foam and send it to the laboratory within 30 minutes. Label the time and site of sampling in blood culture bottle. Inform the patient once the procedure is successful. Discard the safety lock blood collection set in sharp container. Remove gloves and do hand wash. The staff moves the trolley to the nursing station for disposal of the waste. Wear clean gloves and disposes the waste generated during the procedure according to the biomedical waste management and removes the gloves and does hand wash with soap and water. Document the procedure in EMR. Thank you.